Hello, everybody. Dr. Jake here, and we're going to be talking about shockwave therapy. I know we mentioned it a few times in the videos. One thing that was a big reason why we wanted to bring this into the clinic, it was one of the most effective ways to work with not just acute injuries, but also chronic injuries, breaking up scar tissue, making the joints mobile again, and creating a healing process from the inside out, which is right in line with what our philosophy is with chiropractic. And so here I have two of the newest members of our Shockwave team. I have both Mackenzie and Annie. Both are Shockwave specialists. And what's unique about this is they both have their own stories. They were one of the first patients to use Shockwave in this clinic. And I'm going to introduce each one of them, and they're going to talk about what their experience was and what got them so interested in learning more and becoming specialists in this field. So we'll start with you, Annie. I know you are an avid skier and very, very active. And one of the things that happened at the beginning of the year was a pretty severe injury. Can you go ahead and just enlighten us on what that was?
Yeah, so in March, I was snowboarding and had a small fracture at the bottom of my tibia. I was in a walking boot and on crutches, could not bear any weight on my left ankle for a while after that. So I started working with Dr. Jake. The Shockwave machine came in, I think, a week after the injury occurred. So we started with that right away. I got out of the boot and off the crutches, or off of the crutches 2 weeks before I was projected to, I guess. And then I was out of the boot again 2 weeks after that. So a lot sooner than we thought. I started running, I think, 10 weeks post-injury. Mackenzie and I did a 5K a few weeks ago and back in the gym lifting. So all things that wouldn't have been possible if we didn't repair the muscles and ligaments around that bone that had been injured in that injury.
Yeah, and I know that when you were first talking to me, I know surgery was definitely on the table, and that was terrifying, being in your 20s and having surgery a possibility and limiting your activity from here on out. So very cool that that this therapy was able to correct that.
Yeah.
And so much so now she's not only the newest member of the Shockwave team, but she's also one of the full-time members here at the clinic. And so if you ever have any questions or ever want to get to know her a little more, she's always at the front desk willing to help. So next, I have Mackenzie. Now, a lot of you know Mackenzie. She's our nutritionist on staff. She's amazing and has helped a lot of you. But she's also now one of our Shockwave specialists, and she has her own unique story. And I'm going to go ahead and just let her explain what that was and how that came about.
Yeah, so I had a chronic hip injury that really started a couple years ago. I didn't really understand why I had hip pain. I was getting, regular adjustments, but I just constantly was having hip pain walking up the stairs. So I was working with Dr. Jake, and he came to the conclusion that I likely compensating with some muscles when I was working out. So that really was straining some of the hip muscles. So when the Shockwave came in, I was just ecstatic because that hip pain was gone. And really with consistency with the Shockwave appointments, I found that was really giving me the best results. So we're really working through that injury, and he's talking to me about how I can strengthen the right muscles to use the correct muscles and fix the stupid muscles, like he says. So we're really working through that injury, being able to live my best life when it comes to exercise with no pain. That's my goal. So that's really where I'm at. It's continuing to heal my hip.
Yeah, and so both of these conditions very, very different. With Mackenzie, normal rehab was getting her so far, but getting inside the joint and breaking up the scar tissue that was anchoring the joint down was inhibiting with her from benefiting from any of her exercises. So now she's on the way to running and doing what she would really want to do. I know you just went through a 7-day hike recently. And did very, very well, which she was afraid to do 6 months ago. And then Annie having a very acute injury that where fibers were being torn, And if any false movement would have caused additional issues. And so we were able to speed up the process and making sure that she could become mobile as quick as possible, getting through a series of exercises and getting her on the road to 100% recovery. So both of these very different cases, but great outcomes. If you guys have any questions, they're available to be presented to these two as well. And if you have additional questions, come find me, or they'll direct you on how to get in contact with. But love you all. Looking forward to working with you, and I'll see you soon. Bye.